We are in Vaidyaratnam Hall and the workshop on Hijama is going on, and where Hijama is a word where we all knows about Hijama, how popular the word is immediately in our mind. This reflection of the system is called Unani system. It's a popular ancient technique where used from centuries to treat various health issues. On this platform, now in this present scenario, how it is useful and in which disease we can use this technique. Dr. Latif Siddiqui, one of the eminent personality, is going to demo on which cases we can perfectly handle this Hijama. I would like to call upon the dais Dr. Latif Siddiqui, sir. Yeah, sir.
Thank you very much, sir. Hello everyone, very good morning to all. Myself Dr. M.A. Latif Siddiqui, Assistant Professor from the Department of Maulajat Medicine, Government Nizamiya Tibbi College, Hyderabad. Today I am going to present about the Hijama. But before starting the live demonstration of Hijama, that is cupping therapy, I would like to tell you all a very brief about the Unani system of medicine. What really is the Unani system of medicine and what is Hijama, why we perform Hijama, what are the diseases. We will try to cover all this, and along with this Hijama therapy, that is cupping therapy, we will also try to see what is first, that is venesection or phlebotomy, what we call. We will also see that, and we will also try to give a live demonstration about that Yunan. So that comes the Unani system of medicine, and the father of Unani system of medicine is Hippocrates, the same person who is the father of our medicine, Hippocrates. So it is a very scientific system of medicine. There are I think there is some technical issue. I will start. There are 4 modalities of treatment in Unani system of medicine. Means there are 4 ways, different ways of treatment through Unani system of medicine. They are Ilaj bil Ghiza. First we will prefer Ghiza, that is dietotherapy. If any disease come to the patient, what the eminent Unani scholars try to do is they will first try to change the diet. If correction is made in the disease through the diet only, then by dietary changes only they will try to manage the disease of the patient. And in any system of medicine, what is the aim? The aim of medicine or the aim of treatment or the aim of therapy is first to prevent the disease and then to treat the disease. If a person is healthy, then what we have to do? We have to take the measures that the person will remain healthy. And if a person gets any kind of disease, then we have to acquire some methods to treat that disease. So by dietotherapy or Ilaj bil Ghiza, we can maintain the health of the person, we can try to prevent the person from the diseases, and if some disease occurs in the person, if a person get any kind of disease, then we will try to treat the disease with, first we will try to treat the disease with dietotherapy. Then comes the Ilaj bil Tadbir, that is regimenal therapies. These are the methods, these are non-drug therapies. With that we try to treat the disease of the patient. Now in this present world, we have evolved in this 21st century, and from the drug therapies we are going towards non-drug therapies these days. And our eminent Unani physicians have given the concept of this non-drug therapies in the BCs only. In the starting, at the time of Hippocrates or Galen, they have given the concept of this non-drug therapies at that time only. So second is the Ilaj with Tadbir. If the Unani physicians, what they try to do is they will try to do some kind of therapies, or they will try to do some type of adjustments on the patient, and if with medicines also they are not getting response, then they will move to the surgery, that is Ilaj bil Yad. These are the 4 modalities of treatment through Unani system of medicine. Now we will have a look in detail about this Ilaj bil Tadbir. What is this Ilaj bil Tadbir? So in the rich ancient Unani text, what they have in the rich ancient Unani text, they have mentioned 6 factors. There are many factors out in Unani term, those are called asbab-e failiya. So these outside factors are very much involved in the health and disease of the person. There are some factors which are non-essential and which differ from person to person, like some persons who work in coal mines, so they will get their specific diseases. Some persons work in cotton industries, like that according to their business or according to their jobs, they will get specific. But there are some essential factors which are every person will undergo with that essential factors. Those essential factors are, next slide please. These are those essential 6 basic essential factors. In the Unani terminology, they are called as asbab-e sitte zaruriya. They are hawa-e muhit, that is atmospheric air, makulo mashroob, that are food and drinks, harkato sukune badani, that is physical activity and rest, harkato sukune nafsani, that is mental activity and repose, naumo yaghza, sleep and wakefulness, istifrago etibaz, that is evacuation and retention. So these are 6 basic essential factors which every person will have to face. And if there is disturbance and non-equilibrium in these 6 essential factors, then they will develop diseases. So if we see widely in this current scenario, we are to some extent we have tackled these communicable diseases, infectious diseases, through the use of advent of this antimicrobial drugs. Now the main issue is this non-communicable diseases. And if we see in the broad sense, if we see any of the non-communicable diseases you select, there is derangement in any one or many of them, all of them. There will be derangement in these 6 factors. You will see this usually we call this non-communicable diseases as lifestyle diseases. And if you see this deeply, this is the our lifestyle, means that what is our atmospheric air, means if we live surrounded in this polluted air and all this, we will get those diseases. Our food and drinks, if our diet is balanced, then we will remain healthy. Otherwise we will get obesity, dyslipidemias, CADs and all this blah blah. Is the same. Mental activity and rest, repose, means if person is getting tensed, then he will acquire those non-communicable, like hypertension, he will acquire hypertension. If there is imbalance in this harkato sukune nafsani, naumo yaghza, in ancient this Unani literature, they have very beautifully mentioned the time of sleep also. They have considered the sleep of night, that is from the 8 p.m. to the 8 a.m. is the best, 4 a.m. 8 p.m. to the 4 a.m. is the best. If the person sleeps at that time, then our body internal factors also and through the external factors also, he will remain healthy. And today, after all researches, what we are telling that same only. So if there is imbalance in sleep and wakefulness, means 6 to 8 hours of sleep is essential for the person. If he is not getting that required sleep, then he will acquire diseases. And the last is the very important, istifrago etibas, means evacuation and retention. In our body, the evacuation and retention is very important, means the unwanted things, if they get retained into our bodies, then we will acquire diseases. And today what we are going to perform the therapies, that is Hijama and first therapy, it is about this istifraq, that is evacuation only. what we are going to do, we are going to evacuate the morbid matter or unwanted matter which is accumulated in the body and which is going to cause the diseases or which has caused diseases. We are going to evacuate that matter. So with the evacuation of that disease matter, we can remove that disease from the body. And in healthy person, if this matter is getting retended into the body, then by evacuation of that matter at the right time, we can prevent the persons from the disease. So this is Unani doctrine. These are the four humors, that is akhlat. One is dam, that is blood, balgam, okay, that is yellow bile, safra, the dam, that is blood, balgam, that is phlegm, and safra, that is yellow bile, and sauda, that is black bile. These four are the humors. And how we can see, these are the four basic humors in which all the things will happen. So if then the person will get disease. Next slide, please. So we will move towards it comes under the istifrag juzi, means local evacuation we will do through the hijama therapy, and we will simultaneously we will start a live demonstration on hijama therapy so that you can understand it better.
We are going to demonstrate the hijama, which is also known as cupping therapy, at the end of the neck. And we will start at the vertical column. If we correlate with this, it will be at the cervical 7th vertebrae starts.
Yeah.
Thereon, the passes are the number of cups. With respect to the diseases and with respect to the condition of the patient, the number of cups have been selected as well as the positions of the cup have been designed.
Yeah, like Dr. Junaid is telling, first we will apply the cup. There are some prerequisites for this any therapy. First, dry cupping. Only dry cupping is usually collaborated with massage cupping, or it alone will also be done. In the dry cupping, only the primary section will be given to the body. It is massage cupping. What the concept we will do is, first we will select the patient, and these are two important sites 1 and 55. The site number first is at the nape of the neck, which they are going to apply, nape of the neck, and 1 and or 1.5 inch below to that
Of that 7 cervical vertebrae starts the first cup, that is numbered as cup number 1. In almost all the conditions where it not only detoxifies the cervical supply, internal carotids, as well as the thorax, upper part of the thorax and shoulders, where we start the first cup, exactly ½ inch down to that below, that is starting of the first thoracic vertebrae and second thoracic vertebrae, we have point number 2. And 1.5 inch right towards the scapula, we have point number 3, and 1.5 inch right towards the left scapula, we have point number 4. These are the basic 4 cups where it detoxifies the head region, the neck region, the scapular region, the thorax, the ventral thorax, as well as the dorsal part of the dorsum of the thorax.
Now he has applied this cup. This is called as primary section. We have selected the place, we have cleaned that place, and we have applied the cup. This is primary section. It helps in accumulation of morbid blood or morbid material below this under the skin, which is under the cup. This is primary section. This is the gun, cupping gun. It will create the suction inside the cup. So he has applied 2 cups. This is point number 1 and this is point number 55. These are 2 important points which we believe that it covers all the thorax and abdominal regions and evacuate the morbid matter which is accumulated in these regions. So it also stimulates the immune system also through the endorphins. Means any kind of whole immune system is getting awakened by applying some kind of negative pressure, some thing is happening on the body. So the immune system, the complementary system get activated and endorphins will be released, which in turns elucidate or activates the immune system. And usually these 2 are applied, and common ailments in which we applied is this on the for frozen shoulder or for osteoarthritis, rheumatoid arthritis, or any kind of arthritis, we used to apply the cups over that particular region. Different points are there for different diseases, and according to the diseases, the Unani physician will select the point and apply the cup. So this is a primary section. We will leave the cup for 3 to 5 minutes. Then you can see the skin after this primary section. It get darkened. Hyperemic, it will get hyperemic. And after that, we will apply the scarification. We will do scarification, and blood will come out from that. So this comes under the istafragh. That is, istafragh is the evacuation. So what the concept is, this matter is not required for the body. So that, and our sleep pattern is also disturbed. We will sleep at irregular timings. Our physical activity is also disturbed. Our mental activity or mental calmness is also disturbed. So all this will create, what do you think? There is some disturbance, there will be some disturbance in the body. There will be some disturbance. So with this disturbance, we are getting all these lifestyle disorders. So what here we are trying to do? We are trying to remove that morbid matter out from the body. And you can search on the through the internet platform also, through the researched published articles also. This evacuation therapy, this Hijama therapy and first therapy is showing miraculous results. And the concept is very clear. If we see Unani doctrine, and if we think widely, if we sit silently and start thinking, we will definitely come to know that something is happening in the body. If we eat what is not required for our body, then where it will go? It will cause something. It will get accumulated into our body. And if we will not sleep properly, if we not give proper time to our body, if we will not do some proper physical activity, or if we will not take proper rest, and if we are surrounded with not surrounded with proper atmosphere, and then this morbid matter will definitely get accumulated in our body. This is local evacuation. Next, what we will see is first, that is phlebotomy or venesection. That is we call that istifragh kulli, that is complete evacuation. In that we will see often with that therapy.
Now we have only venous blood will come. As we know that superficial layers are containing only veins and veinlets, but they will intend the pressure and deep squeeze from the tissues, and that will come out up on the surface. When you give a very delicate touch with the surgical needle point, that is number 11, which is mostly used in Hijama, giving small minute cuts, or we can say the scratch, which is around 0.2 to 0.4 mm, we will give in deep. Only epidermal layer will be cut in that, and that will be, is it?
He is taking superficial incisions, which is about 1 or 2 millimeter deep only, and patient is not getting any kind of pain also. Because of the suction, because of the cup pressure, that nervelets or nerve endings which are present there, that will also get anesthetized. We can ask to the patient also whether he is, by seeing we are feeling pain, but by getting the scarification, patient is not getting that much pain what we are thinking of.
क्या मोहसिन भाई दर्द हो रहा है? It feels very little. Those who have sensitive skin are having skin conditions. Maybe they feel more pain. Otherwise, it is a natural phenomenon, a super phenomenon of natural anesthesia, you can say, where the local area are locally anesthetized. So no pain he can feel till the time at around 10 to 15 minutes where our procedure will end. After taking the incision, again the cup is applied and evacuated. The pressure is nilled, So after depressuring, now you can see that blood is oozing out. This is venous blood, toxic blood you can say, the blood from the deep tissues as well as superficial tissues, which is containing most of the cell dead debris, residues, as well as the toxic cells are killer cells we can say. If we analyze this, you will find if the thickness of the cell is more and color is more darkened, that shows the disease condition is advanced or chronic. And if it is brightened, we can say that patient is healthy. By observing on the evacuation of the blood, we can able to interpret what the health condition of this certain patient and what disease probably he will be having. So there will be some pus-like material you will find in certain patients who are having the active phase of infection or having chronic infections. And those who have skin problems, you will find blister formation again. It is not a painful condition, but it will sound like different. Patient will get worried what happened. Nothing to worry, it is only due to the upper dermal layer of the skin which form the blister due to skin conditions. This point number 55, which is also called as Sunna point, as you know, it is also in religious aspect called as prophetic medicine. In the practice of prophetic medicine, this is been very significant. This point is crucial. It has been said that 70 diseases can be prevented with this only one point. So I was amazed to know how it could be done. So to little my knowledge, I have inquired about this. I have and parathymus glands. Excuse me. Syndromes where the acute condition and acute diseases can be triggered with this thymus gland. So it directly intervenes the thymus and it normalizes the thymus functioning, as well as it intervenes the cardiovascular function, the liver, the splenic function, as well as the pancreas. For the reason, it has been said in prophetic medicine that it can prevent 70 diseases, which is systemic as well as non-systemic type of diseases. So I was amazed to know it, and you will be also very glad to see once if you go in deep the detailing about this, the significance of each and every point, where it is correlating to the underlying surface, underlying organs and the organ system, as well as the local area and generalized systemic area of the body, how wonderfully it is functioning. It is not merely taking out the morbid matter, but at the same time, it is stimulating the local nervous system, which in turn is stimulating the central nervous system by sympathetic action again. And along with that, the localized blood circulation area has been improved, and that in turn helping to improve the overall blood circulation of the body. The Hijama or cupping therapy has got such a wonderful action in terms of balancing the blood circulation. If the patient is having high blood pressure or hypertension, Hijama is one of the beautiful treatment to instantly trigger the high blood pressure to normalize blood pressure. But for hypotension peoples, it is contraindicated because Hijama cannot elevate the blood pressure at the same time. And, there are certain helping cells or endorphins which are released in the body, which cures the local inflammation or infection or injury. At the same time, it starts the healing process. So Hijama helps to improves the healing process of the body. And according to nitrous oxide theory, wherever there is an injury, the nitric oxide is released, and this nitric oxide is a best antioxidant or anti-inflammatory, which heals the inflammation and as well as the infections. So in this way, Hijama is helping to proving to get helped for infections, inflammations, local type of infections, as well as the pain conditions. Now we can able to remove the cup.
Starting, I have discussed that in the Unani doctrine, there are 4 modalities. First, they will treat through the changes in
Patient complete. Cup has been removed and it has been dried with the powder. Antiseptic powder has been used. Now you can see here the scars has been made. It may bleed, very feeble. Serum may come out. But now it get closes. But it is said in the theory of Hijama, Hijama get activates till 24 hours of the performance of the procedure. That is because of the micro circulation which has made like semi-permeable membrane to get the osmotic pressure. When the outer oxygen content is higher in the atmosphere, even it can take the oxygen from that minute pores which is semi-permeable. So for that reason, after Hijama, the bath or water on the surface is avoided. This is one of the reason. And we want maximum blood to be pulled out to the surface. That's why there is another instruction to be given to patient is that not to take the heavy meals so that the blood may not move more towards the gut. We need at the peripheries or the places where we have performed the hijama. This will give more opportunity for the blood to get purified or get more oxygen in it.
And there is another concept also in the Unani doctrine, that is the eminent Unani physician have selected some dates for this hijama therapy from the science has proved that on this from the lunar action there will be increased in the peripheral pressure of human body also because of the moon gravitational pull. So eminent Unani scholars has prescribed some dates, middle dates, that is 17th, 19th and 21st of the lunar calendar. These dates are preferred for performing hijama, and the concept is the blood will move towards peripheries or onto the near to the skin. And our next therapy is, and in this therapy, in the ancient era, what usually was done is any superficial vein is selected, and or else the vein is selected according to the disease, and a small scarification or scar is given on that vein through the lancet, and blood is let out from that vein. Now in this era, what we are doing is we are taking 18 number needle. And by seeing, I will show in the next slide, by seeing the blood which has let out from the vessel, we can see which humor. We have seen that slide of 4 humors. We can site. We will select a vein, we will clean the local site, and we will apply 18 number needle over it. See, the blood is coming from the needle. We will collect nearly 50 to 100 ml of the blood.
It seems
one
Dr.
important
Nasmi-
note is if patient is feeling some uncomfort or any kind of dizziness, then abruptly you have to stop the procedure, and you have to let the patient lie down. Then the patient will be okay. To the patient, then abruptly we have to stop the procedure and let the patient lie down. And after this therapy, what usually happens, I have also undergone this therapy, and we will feel fresh after performing this, undergoing this therapy. We will feel fresh. The whole day we will remain fresh. Lethargy will be gone. From the vein, that is central blood system, we are evacuating the morbid matter. This is istifrag kulli. Any one of the vein we can select, and we can perform this therapy. So any one of the superficial vein you can select, and it is showing very good results in dyslipidemia. And at regular basis, we used to perform this therapy on varicose veins. In varicose veins, what happens? Local congestion will be there on the veins. So we will apply the needle on the humor is dominant in that. Here it is more reddish one, that is blood or khilte dam is dominant. In the second, you will see somewhat white, that is dyslipidemic patient. In dyslipidemia, we have some peaks in that we have collected hypertension, malignant hypertension also. If the patient BP is 170 over 100 or 180, 120, in that patients also we can apply this venesection therapy, and after performing this procedure, immediately we can see the BP, the patient BP will reduce. So hypertensive patients also. And usually what will happen in our body naturally is if the patient get that much high BP, then any of the blood vessel will get rupture. Usually CVAs will happen, hemorrhagic CVAs will happen. So if we reduce that blood pressure, overall blood pressure, then we can prevent the patients from that. Now I think nearly cleared, then we will remove the needle. These are the prerequisites which you required for both of these therapies. And preparation of patient is very important. First we have to be percentages below it, we can't perform this first therapy. Already patient is blood deficient, we can't do. Blood sugar levels, bleeding time, clotting time and viral markers we have to perform. Procedure we have to examine the vitals. If all the investigations are within normal limit, then we will. To me, my take home message is quality matters. We have to maintain the quality in everything. We have to maintain the quality in our thoughts. We have to maintain the quality in our procedures, in our time, in our drugs. If quality is maintained in our diets, in our drinks, in our sleep, in everything, if we maintain the quality, and in our procedures also, if we maintain the quality, then definitely we can do miracles. Thank you very much. Thank you. Thank you.
Thanks. Wonderful, sir, that your team has been elaborated pin to point with a section wise, and as usually explaining about the lifestyle patterns as also the dietary patterns regarding, and the knowledge on Hijama and the inputs we have given in this venue are more valuable, that were very much useful in the practical approach. And also I would like to thank and appreciate the patient who has been cooperated for this particular demo. Thank you, sir. Now I request the guests to take over the felicitation and give a round applause to our Dr. Siddiqui, sir.
And special thanks to Dr. Nasmi and our patient, Mr. Mohsin.
And from the audience also, from the delegates also, do you have any